And let me kind of give some context here. Here's the question: what is a vaccine, and do they work? And that, and I'm gonna mention too that back, I think it was in the 1700s. I'm sure you know all about this. There was the smallpox epidemic that thousands of people were dying from it, and they discovered that if they gave people cowpox, that it actually cured or it prevented someone from getting smallpox. So scientifically, how does that all work, and how do we apply that to it today?
That's propaganda. See, the problem is people don't want to believe that their government lies to them, but they do all the time. I have a poster here in my office, a quote from William Casey, who was the former director of the CIA, and he said, "We will know our disinformation program is complete when everything every American believes is a lie. Vaccines have never worked. Vaccines have never worked. We didn't have autism before the introduction of vaccines. We had no sudden infant death syndrome before the introduction of vaccines. When I was a child, when you went to school, you only had to have about 6 vaccinations. Now the children have to have 52 vaccinations. This is a way of killing children, destroying them, giving them learning disorders, all sorts of variants of autism. Vaccinations have never worked. The reason people think they work is because the government keeps telling you that. People don't want to believe that the government is lying, because it's like believing that your mother hated you and wanted you dead. The person who used to be head of the Centers for Disease Control was Julie Gerberding. Julie Gerberding was during, I think, the George W. Bush administration. Julie Gerberding worked with me at San Francisco General. She was an infectious disease doctor. I saw her regularly. Orthopedics had to work with them. When the AIDS epidemic came along, Julie and I were on a television program in San Francisco, the first television program I was on to discuss AIDS. Now, Julie's not a surgeon. We're surgeons. We're covered with blood, and we use sharp instruments and heavy instruments that like power saws and power screwdrivers and power everything that sprays blood everywhere. Julie never got any blood on her. So here's the thing. What Julie said on that television program was a lie. She said that AIDS was not a 100% fatal disease, and at that time, she knew it was. And she said on television that it was not. And my mouth dropped open. So I said to her when we left after the show, we were walking out, and I said, "Julie, why would you say that AIDS is not 100% fatal? You know it is." She said, "Yes, but we have to watch out for the psyche of the AIDS patient." So she lied back then, and she was rewarded for lying by being given the chairmanship, the directorship of the Centers for Disease Control, where she's supposed to be neutral about vaccines. Now she happens to be the president of the vaccine division of Merck, and she just cashed in some of her stock. It was in the paper. I know these people. I've worked with these people. I know the people who are involved in the NIH. I've been on NIH committees where they lied through their teeth. Now, doctors all believe what the NIH and the CDC says, and I used to until my eyes were opened by dealing with these people. Let me just give you an evidence of how they lie at the CDC. When they started having flu vaccinations, they started saying, "Oh, you need to get a flu vaccination because the flu is bad." Well, the flu isn't bad. It's a self-limiting disease. You get sick for a few days because of the way you're living, eating, and handling stress, and then the body gets cleaned out, and then you're well again. Okay, it's a self-limiting disease. God made the body to heal itself once you stop abusing it, just like I got well from cancer. They said, 37,000 people die every year from flu and pneumonia. But
right.
Nobody dies from the flu. Why do they couple it with pneumonia? Well, when anybody dies from heart disease, Parkinson's, cancer, the end event usually is pneumonia because they're bedridden, they're sick, they're not moving around, and they get pneumonia, okay? So they die of pneumonia. They're really dying of cancer, but the end event is pneumonia. So they had to take all the pneumonias and put them with the flu in order to make it look big enough to get people to take a flu vaccine, because the CDC is nothing but a vaccine store. That's what they do. They have a foundation where every one of these vaccine companies contributes to the CDC. This is where they make a lot of their money. And so they had to, so I looked up to see how many of these 37,000 were from pneumonia and how many from the flu. And guess what it was? It was about 36,990 from pneumonia and about 10 from the flu. But they grouped together because they could never get you to take a flu vaccination. They've told you that only 10 people a year out of 350 million in the United States die from the flu. So they had to put pneumonia with it. All right?
Wow,
so now they're saying, oh, well, all these people generally die of the flu anyway, but they don't. Almost nobody dies of the flu.
So back in, I think it was 2017, on the CDC website, 16 or 17, they said that 80,000 people died from the flu. But no one cared about the 80,000 that die, and that die every year.
What am I saying about? It's nothing but a cover to bring in a communist, totalitarian, new world order. That's what it's all about. And everybody will be so thankful that they get out of their homes one day and don't have these severe restrictions, that they won't care that, no, now I can't travel without a smart ID. Now I'm not allowed to go here. Now, oh, they just want me to take a vaccination. Okay, I'll do that. It is they're bringing in communism to America. When they take away all the rights for a short period of time, people are thrilled to just have some rights, and they're not going to realize what's going on.
Somebody asked, why are healthy people, some of them aged 12 to 50, with no underlying health problems, dying from this virus?
Oh, good. Show me those people. Give me the evidence. You're just listening to the talking heads. Bring some of these people to me. I don't know a single person who has the coronavirus. Not a single person. I don't know a single person who does know a single person. Okay? So bring them to me. Show them to me. And show them that they're sick because of the coronavirus. And just watch it. Turn off the television set. That's what I say. Turn off the television.
So here's a question. You still have family that works in the medical field, correct?
Yes.
Okay. So this is for the people out there that are having a really hard time right now believing that this thing isn't as big of a deal as the media is making out. So what are you hearing from your family that's in the medical field?
Well, first of all, my daughter-in-law is an anesthesiologist at a 650-bed hospital. There are only 5 patients in the whole hospital that have even tested positive for coronavirus, and they're not in there because of those. They don't have any symptoms of the coronavirus. I have another friend, actually a relative, who is at UC San Francisco. It's about a 1,200-bed hospital. They have 6 patients out of 1,200 beds that have tested positive for the coronavirus.
Do most doctors actually know this isn't as big of a deal as everyone's making out?
Probably not. If they're in hospitals, they'll know that there's a faking going on. At one hospital, they had to sign up, this is a drill. But if they're in private practice, they would have no way of knowing. And let me tell you this, when you're in high school and you want to be a doctor, what do? You work hard, you get good grades, and you never rock the boat. So you get into a good college and you work hard, you get good grades, and you never rock the boat. Then you get into a good medical school, you want to get into a good residency, so you work hard, you get good grades, and you never rock the boat. So by the time they get out, they can't even think. They are not allowed to ask questions. They can't even think. When I spoke out about the AIDS epidemic, there were only 2 of us surgeons in the entire country speaking out about the risk to healthcare workers. 2 of us out of how many hundreds of thousands of doctors. There are only 2 of us, because they would come to me and they say, oh, so glad that you're speaking out because, we need somebody. I said, why don't you do that? Oh, well, I would lose my practice, or I said, you're just a wimp.
Yeah.
You're right. Yeah.
Stand up and be counted and speak out. Well, I had my life threatened by the government when I was speaking out. A very, very strong threat. I have had black helicopters hanging over my house where I live right now, where I'm sitting talking to you. about every week for several years, shaking my house so violently that it shattered a floor-to-ceiling glass window. I have had death threats through the mail from government agencies.
When people hear a black helicopter over your house,
What does that mean?
what does that mean?
Well, there's a black helicopter and it has no markings on it and it's shaking my house violently. It's trying to intimidate me. They were so close I could I would go out on the sidewalk in front of my house and wave to them. I could see their faces. Black helicopters that are unmarked means they're from the government and they're there to intimidate you.
Okay, I've got a question for you. Did they wave back?
No. Many of these are very complex subjects and we would need a whole lot of time to do it. But I think that to really get the point, it's not the coronavirus, people. It is not the coronavirus. It is what they're doing under cover of the coronavirus. That's what you have to really look at. They're taking away all of your rights. Do you think that you have all the rights that you should have right now? No, you're not allowed to leave your house. You're not allowed to go to the grocery store and get what you normally get because it's not there. Don't you realize that you're can't even have a birthday party for your children? And you think, the government is trying to help me, save me. No, they're not.
Recently, news has brought out the potential of a treatment for COVID-19 using chloroquine, zithromycin, and zinc. Understanding the guidelines and supposed timeline for a vaccine being months and months down the road, do treatments require some government and oversight? Basically, what I'm asking is, what are the loopholes for recognizing and distributing a treatment in comparison to that of a vaccine? And if not, why isn't this being touted in the media?
I'm going to read you the psychiatric side effects. Look it up on the website. Drugs.com. Here's the psychiatric side effects of chloroquine. Psychosis, mania, delirium, anxiety, agitation, insomnia, confusion, depression, and wanting to kill yourself. That's just the psychiatric ones. That's you want to take chloroquine to make sure you don't get the common cold.
This lockdown, they're locking everything down. They're making everybody go in their homes because of this virus. But is it possible that we'll see more deaths from the lockdown not to do with the virus than we do with the virus itself? Because people now aren't able to get outside. They're not able to get fresh air. They're not anxiety, stress, all that stuff that comes along with it.
Staying home with their unruly children.
Is it possible they'll get more unhealthy from this lockdown than they will actually from the virus?
Of course. And that's what the government wants. Wake up. Figure it out. That's what the government wants. The government wants you sick.